So,
Okay,
all
so
right.
I guess thanks everyone for joining us this afternoon. Thanks, Tony, for the introduction. Welcome to my barrio. So, I'm excited to be the one to get the ball rolling. Hi, I'm Tetel, and I'm a doctor to the barrio. So, before we start, I guess I'd like to expound a little bit on my background because I think when we're talking about problem solving, you have to remember that that process really never happens in a vacuum. Meaning it's never really as simple as, hey, here's the problem, here are your solutions, so go do it. Really, a big part of this process is yourself and what you bring to the table. And that includes the perspectives that you have shaped by your experiences, the resources you have, the barriers and challenges you face, your networks, your passions, your training, all of those you carry with you whenever you encounter a problem. So for me, I had been dabbling in public health since 2012, where I started in PhilHealth, where I first really encountered the people on the ground in the regions outside NCR. And what I really brought with me during that time was every time I talked to them, something they often told me was, a lot of the programs and the policies are great. Uh, a lot of the programs, in theory, make sense, but the implementation on the ground is so difficult. We are very challenged to really implement it as it's written. And I couldn't understand at the time. I was young. I was new. I was a fresh graduate. I couldn't really understand why. What is holding us back? So fast forward to my medical studies, where part of my training was rotating in both public and private hospitals. And during my time there, it became very, very difficult to ignore that there were really stark disparities between those two contexts. And the unease I felt with that, coupled with the curiosity I got from my previous work, it really pushed me to eventually, as soon as I was licensed, to sign up for deployment as a doctor to the barrio. So then I found myself in a small but beautiful town in Mindanao. And contrary to what a lot of my friends initially thought my work would be, it wasn't really just consults and patient interactions. That was just a very small part of my responsibility. So I served as the Municipal Health Officer in charge, looking after the more than 50 plus public health programs for a fourth class municipality composed of about 12 to 14,000 people. So it was a coastal town. Farming, fishing, forestry were its primary industries, and there were 13 barangays. We had a number of indigenous person communities and several geographically isolated areas. And by geographically isolated, I meant we had to ride motorcycles up to hours just to get there, where signal was bad, access was difficult. So that was where I found myself. And then fast forward to March when the pandemic hit, I was well into my second year of deployment in the area. So by that time, I had become acutely aware of the unique challenges in the locality. So I had spent really a big chunk of my year. So when COVID came, everybody made a big deal like, oh, it's an epidemic. But what they forgot was during the first year of my deployment, I had spent a big chunk of it firefighting. Uh, it was riddled with epidemics. We had measles, we had polio, we had dengue, and now we had COVID, this unknown disease. And it was so new, it was part of its name, the new coronavirus. And it had unknown features, unknown treatments, unknown capacity for damage. And we were watching on the news, we were watching it ravage more developed areas and countries around the world. So the question was, okay, how do we win? How do we win against this unknown enemy? So to say I was worried was an understatement. Now, throughout my deployment, I think, and my friends can attest to this, a general theme to my time there was, you know, we have no other option. We have to succeed. Because let's say, I'll just put it in context. When I arrived there, it was during the resurgence of measles. Prior to deployment, I had worked in an ER of a hospital in Metro Manila, and A lot of my cases were children dying of measles, a vaccine preventable disease. So when I arrived there, we needed to conduct supplemental immunization activities to protect children from that disease. And we had to vaccinate more than 1,000 children spread across the community, with some in hard to reach areas, and just 4 persons to do it. And guess what? Occasionally, there was the issue of armed conflict. So, really, I always found myself saying, when I would talk to my friends, I'd be like, wow, grabe, ang hirap, no? And I kept thinking, wow, there's so many challenges. But you know what? We have no choice. You cannot lose. Hindi pwede matalo because the consequences of failure are so horrifying. They're unacceptable. If a child gets measles, he might die. If a child gets polio, he might be disabled for life. And COVID, what would COVID do to us? So we need to win. So when we're talking about health systems, a lot of people are like, what's the problem? Well, really, let's look at it from the lenses of COVID-19. COVID-19, in the same way as it affects persons on the individual level, on a systemic level, its effects are generally more devastating when you have pre-existing conditions. If you're already sick, you're more likely to have a severe version of the problem. So for a long time, we faced the problems of a disjointed public health system in which inequity is just so pervasive. So depending on where you were born, on your location, on your financial capacity, maybe even on your education status, your health outcomes could be different. And health systems are so complex because they rely on an interplay between almost everything. Even things that you don't imagine would be part of it, they're part of it. Like roads are part of it. Because without roads, how do I reach those people? So if you're looking at it through the lenses of its different building blocks, and they're outlined here, everything has to work together so that you can have a functional and responsive health system. So political climate matters, human resources, and importantly, their distribution matters. The availability of medication, specialized care, that matters. Financing mechanisms, roads matter. So really, when we started, we had a handicap. So looking into that and looking at COVID-19, here you have it. A problem of this scale. How do we stay safe? Uh, I had been there already for more than a year and I got really attached to the community. So how do I keep the people I have been caring for the past year? They were my friends, they were my workmates, they were the family of my workmates. Some of them were already my godchildren. How do I keep them safe? How do I shield them from this and minimize suffering? So I looked at it and thought, wow, so big, what a big problem. And we can't do it alone. We need to engage because you need to attack this from all angles. And that's what we did. So these are just some of the programs that we initiated. And during the first few months of the pandemic, it's very difficult to go through all of them separately because really the process was very organic. We had to jump from one to another because we needed to act fast and we needed to attack this from everywhere. So I spent a lot of nights thinking, really, okay, what do we know? All right, so I was reading a lot, trying to stay updated. Okay, what do we know about this? Now, what don't we know? And then the next question, what could the effect possibly be here if it gets here? What was the capacity of the local health system? In general, what was the level of community engagement in public health even before this? And a big question was, what would it look like if it gets out of control? So when I started to reflect on that and had an idea of what we were fighting, but more importantly, an idea of what we were fighting for, I had to shift my thinking into what can we do? We need to do something. So, what do we have in our arsenal? The prescriptions were clear. There was a guidebook, there was a pandemic guidebook, quarantine, isolation, disinfection, hand hygiene, social distancing. Uh, that's what we had against COVID 19. So, common to them was that they also required behavioral change. And I recognized that even if I wanted to, I could not possibly wash my hands for 14,000 people to keep them safe. They needed to do it, they needed to be part. So, how do we get them on board? So then you look at it and think, okay, how will we do this? Recognizing how large the problem was, knowing what resources we had and that we couldn't do it alone, really a whole of government and whole of society approach would be the only effective way. We had to work together, and I was thankful because in the rural areas, the sense of community is so strong. As somebody who grew up in Manila, that was something that was lacking, I think, in my life. Like when I got there, the sense of community is so strong, you could hardly ignore it. We're invited to each other's homes. When anything happens to anyone, everyone knows. Everyone was someone's relative. I even became children's godmothers. So many even went to the same school together because there's one large high school. So everybody was connected and we needed to tap that network. So we tapped the community, and luckily the community responded. I think when this exploded, everybody thought, wow, that's a big problem. What can we do? Um, and a lot of people felt unrest about sitting back and letting everybody else or the health workers do it themselves. So we began to work closely with the different members of the community. We tapped the rescue team. So the rescue team of the town, these are the people who were trained and tasked to respond to disasters. So many of them are actually volunteers, young people who were giving their time so that they could respond to any disasters or emergencies whenever needed. So until now, the members of the rescue team, even with the majority of them acting as volunteers, they're continuing to oversee the control efforts in the community. We worked with the teachers and students. That was one of my most favorite collaborations. Um, and I will show you later. So for those with layout skills, we asked for help in creating our educational materials, and we were talking and meeting with the local government officials every day. I was connecting with my networks to get advice and access to other perspectives. And we made our case to the local government about investments we needed to make, and they supported it by providing us the budget to get those done. So we did our best to include as many people so that we could really attack this from different angles. So that was the community's response. The community became engaged. They decided to help when they could and in ways that they could, to use their skills and talents so that they could add to the efforts. Because we really needed them to be part of it, to be proud of it, to have trust in us, to empower them to act, to not be scared, and recognize that really the front lines, the very front lines, the very first line of defense is the community. It was in their homes. It was in their homes through their actions. So that was something that was great to see the collaboration between the community. And what were we able to do? So I guess just to go through a little bit about some of the achievements we were able to do. For quarantine and isolation, through our local consultations, we were able to get every single barangay to create their own isolation facility. So in the span of 3 months, we were able to reach a capacity of the capacity to quarantine of over 100 people. We were also able to repurpose the local wine distillery that used Nipa sap, a popular alcoholic beverage in the community. And we asked them, could you fix the process so that we can yield higher alcohol content and create a local version of sanitizers. A teacher and his student who approached us and said, "We want to give you these ways to help dispense sanitizers." They developed food controlled hand sanitizers that were cost effective, and now with a steady supply of local alcohol, we could put them in public areas and provide free sanitizers to the community. Because people approached me wanting to help, I wanted to find ways to use those funds to address several needs. So we did a call to the community. If you have extra fabric, make a face mask and we will purchase it. So in that way, we were able to inject more funds into the economy, provide people some opportunity to get extra income in the middle of a pandemic in a community where most people are no work, no pay. Give them another option. Give them an option to get more income, and whatever face mask they made, we gave it back to the community. Because if we were to require everyone to wear a face mask, we needed to help them get those. And lastly, and this is one of my favorite projects, was really the Lanuza community educators. So what happened was, at the start of the pandemic, a lot of teachers had to stop and school was out. So what happened was, I sat with them and I said, "Hey, we can strap a speaker to a car and send out and play out in the local dialect the things that people needed to know. But whether or not people would listen, that was up to them. We can put flyers on public spaces, but whether or not people would stop and read it, that was up to them." And being there for more than a year, I knew that people listened to their peers. So what the teachers and I did was, after talking to them, they organized and they went house to house, 3,000 households. And they went to areas that were hard to reach, that had no internet, and they sat down, answered questions, recruited support. We mobilized every single household because we couldn't leave anyone behind. So really, when we were trying to find ways to work on this, what was critical was really acknowledging the barriers that were existing so that we could solutions. Did they have the budget to invest in a steady supply of hand sanitizers when there were some that are already struggling to begin with? Were there enough hand washing stations? Because even if I wanted to wash my hands, if there was nowhere to do it, how would I do it? Could we ask them to stay informed if they had no access to the internet and that's where all the information was? Was it feasible to ask them to quarantine at home and advise social distancing when some of their houses are just one room with 4 to 5 people cramped in there? So really, in order to be responsive, you needed to understand their context. And you had to bring the fight to their homes. So for me, why? Why did I get into public health? Why did I do it this way? No? Personally, public health is my theory of change. I believe that when people are healthy, they have a much better chance at creating better lives for themselves and achieving their potential. It's very, very difficult to go to work, to go to school if you're hungry and malnourished. It's very, very difficult to engage with other people or whatnot if you're fighting a disease. So you needed this is my theory of change, is that health and making sure everybody has a baseline level of it uh, is something we need to work for. So when we are able to do that, I think we can see more sustainable development in the Philippines. So my vision for the future is really to see a functional health system all across the Philippines. So regardless of whether you are in Tawi-Tawi or Manila, it shouldn't make a difference because we have a functional health system everywhere. So what are the gaps and challenges in realizing this vision? There are a lot. There are so many. And really, we have legacy barriers to undo. Uh, we have we have a lot of conversations that need to be had. Uh, but I think this does need engagement of everyone, a whole of government, whole of nation, whole of society effort. In the short time that I talked with you guys, I wish I was able to show you that really everybody has something to bring to this table. How we solve problems depends on what you're bringing, and everybody can add to this. Everybody can contribute to this. So my question, I think, for everybody here is how might we, because we saw, and I hope I showed you that the community was able to mobilize in order to respond to this together. So how might we engage all members of society to participate specifically in the public health response? Because I think for a lot of the discussions and for a lot of people, um, the public health is left to the public health specialists. The public health interventions are for the doctors and the people who understand it more. But I hope I showed you that everybody can take part. So how can we do it to strengthen the COVID-19 public health response? What can you bring to this table? So thank you. I hoped I was able to show you a little bit of my life and my perspective. I hope we can open the conversations so that we can find the solutions to this problem. So thank you.
So just to recap, one of the key takeaways that I think was really inspiring for me was how you were able to recognize the scale of the problem, but you also recognized the resources that were available to you. And for Lanuza, that was the community. And it kind of how you knew how that you needed a whole of government and a whole of society approach. To quote one of the comments I saw in the chat box from Gisela Velasco was, public health is not just about medicine, but the holistic well-being of a community. And I think when you're in Manila, it's so hard to kind of see that. Parang it's kanya-kanyang bahay dito, but I feel like you responded to it in a really different way. And I think that's super inspiring. So thank you again, Tetel.